Children taking a prescription stimulant to manage symptoms of attention deficit hyperactivity disorder, ADHD, do not have more substance use or substance use disorder, SUD, as adolescents or young adults, according to a new study by researchers at the University of Pittsburgh School of Medicine. Published July 5, 2023, in JAMA Psychiatry. In today's video, we delve into a topic that affects millions around the world. Attention deficit, hyperactivity disorder, or ADHD. Join us as we explore the causes, symptoms, treatment options, and strategies for prevention that can pave the way for progress and improved quality of life. Whether you're a parent, educator, healthcare professional, or someone seeking a deeper understanding, this video aims to shed light on the multifaceted aspects of ADHD. This neurodevelopmental disorder affects people of all ages and walks of life, presenting unique challenges and opportunities for growth. At its core, ADHD is believed to result from a complex interplay of genetic, neurological, and environmental factors. Recent research suggests that certain genetic variations and brain chemistry imbalances may play a pivotal role in its development. ADHD, attention deficit, hyperactivity disorder. Here's some information on it. To fully understand, researchers are working hard to better understand the underlying causes of ADHD and to develop more effective treatments and interventions. It is believed this disease has resulted from a combination of genetic, neurological, environmental, and developmental factors. Here are some key factors that are thought to contribute to the development of ADHD. 1. Genetic factors. There is a strong genetic component to ADHD. Research has shown that ADHD tends to run in families, with a higher risk of having ADHD if a close family member also has the disorder. Specific genes related to brain function, neurotransmitter regulation, and dopamine signaling have been implicated in ADHD. 2. Neurological factors. Brain imaging studies have revealed differences in the brain structure and function of individuals with ADHD. These differences often involve areas of the brain associated with attention, impulse control, and executive function. Neurotransmitters, particularly dopamine and norepinephrine, are also thought to play a role in regulating attention and behavior. 3. Neurodevelopmental factors. Abnormalities in brain development during critical periods of growth may contribute to ADHD. Factors such as prenatal exposure to toxins, premature birth, low birth weight, and maternal stress during pregnancy have been studied as potential risk factors. 4. Environmental factors. Exposure to certain environmental factors during early development could increase the risk of developing ADHD. These factors might include exposure to lead or other toxins, maternal smoking during pregnancy, and certain maternal infections. 5. Brain chemical imbalances. Some researchers believe that imbalances in neurotransmitters like dopamine and norepinephrine, which play roles in regulating attention and impulse control, might contribute to the symptoms of ADHD. 6. Brain structural differences. Studies using neuroimaging techniques have shown differences in brain structure, connectivity, and activity in individuals with ADHD. These differences are often found in areas responsible for attention, impulse control, and executive functions. 7. Maternal health during pregnancy. Factors such as maternal substance abuse, alcohol consumption, or poor nutrition during pregnancy could potentially impact fetal brain development and increase the risk of ADHD. 8. Birth complications. Certain birth complications, such as oxygen deprivation during delivery, have been linked to a slightly increased risk of ADHD. It's important to note that while these factors contribute to the development of ADHD, they don't individually cause the disorder. ADHD is likely a complex interplay of genetic predisposition, brain development, and environmental influences. It's also worth mentioning that there is ongoing research to better understand the underlying causes of ADHD and to develop more effective treatments and interventions. If you suspect you or someone you know has ADHD, seeking a professional diagnosis and treatment is recommended. Symptoms of ADHD. ADHD is a neurodevelopmental disorder that typically manifests in childhood and continues into adulthood. The symptoms of ADHD are divided into two main categories: inattention and hyperactivity, impulsivity. Inattention symptoms. Difficulty sustaining attention in tasks or play activities. Making careless mistakes in schoolwork or other activities. Difficulty organizing tasks and activities. Avoiding tasks that require sustained mental effort. Often losing items necessary for tasks and activities. Being easily distracted by external stimuli. Forgetfulness in daily activities. Hyperactivity, impulsivity symptoms. Fidgeting or tapping hands or feet. Inability to remain seated in situations where it's expected. Running or climbing in inappropriate situations. Excessive talking or interrupting others. Difficulty waiting for one's turn. Impulsively blurting out answers before a question is completed. Difficulty with impulse control. ADHD manifests through a range of symptoms. Individuals with inattention may struggle to focus on tasks, easily become distracted, and have difficulty organizing activities. On the other hand, hyperactivity and impulsivity may lead to restlessness, impulsive decision-making, and difficulty waiting one's turn. Early identification and intervention are crucial. If you suspect ADHD in yourself or a loved one, seeking a comprehensive assessment by healthcare professionals can pave the way for tailored support and treatment. Treatment of ADHD. While there's no cure for ADHD, many treatment options are available to help you manage your symptoms. Clinicians call ADHD a neurodevelopmental disorder, meaning that it affects a person's behavior, memory, motor skills, or ability to learn. When it comes to treatment, a multifaceted approach is often recommended. Behavioral interventions, psychoeducation, and, in some cases, medication can help manage symptoms effectively. The treatment of ADHD often involves a combination of behavioral interventions, psychoeducation, and, in some cases, medication. Proper nutrition, brain-boosting supplements, physical exercise, adequate sleep, and limited screen time may maximize the impact of these ADHD treatments. Behavioral interventions. Behavioral therapy focuses on teaching individual skills to manage their symptoms. This might include strategies to improve organization, time management, and impulse control. Parent training and support can be crucial, especially for children. Parents learn techniques to manage behavior and create structured environments. Psychoeducation. Providing education about ADHD helps individuals understand the nature of the disorder, its impact on daily life, and strategies for self-management. Medication. Stimulant medications, e.g., methylphenidate, amphetamines, are often prescribed. They can help improve attention and impulse control. Non-stimulant medications, e.g., atomoxetine, are also available. Medication decisions should be made in consultation with a qualified healthcare professional. Prevention and management. While there's no guaranteed way to prevent ADHD, there are strategies that can support individuals with ADHD or reduce the severity of symptoms. Early intervention. Identifying and addressing ADHD symptoms early can help in developing coping skills and strategies. Structured environment. Creating routines and structured environments can help individuals with ADHD manage their symptoms more effectively. Healthy lifestyle. Regular exercise, balanced nutrition, and adequate sleep can positively impact ADHD symptoms. Therapeutic support. Psychotherapy, counseling, and support groups can help individuals learn coping mechanisms and manage emotional challenges. Effective communication. Open communication between parents, teachers, and individuals with ADHD is vital for understanding and managing the disorder. Mindfulness and relaxation techniques. Techniques like mindfulness meditation can help improve attention and reduce impulsivity. Remember, ADHD is a complex condition, and its management can vary from person to person. It's important to work closely with healthcare professionals to develop a tailored treatment plan based on individual needs and circumstances. Disclaimer: this video is for informational purposes only and should not be considered medical advice. If you found this video informative and engaging, we invite you to hit the like button below and subscribe to our channel. By subscribing, you'll stay updated on our future videos covering a wide range